Hi, it's Dr. Noel Williams, Optimal Health Associates, COVID update, March 9, 2021. Great news heading our way, herd immunity. If you look back at my post from a few days ago that's written, I go through the statistics on herd immunity in Oklahoma. I did not do it for the United States, but you can take the numbers and run them the same way and come to the same conclusions I have based on statistics. And these are immunology statistics, so I think we can believe that they're just raw numbers. There's nothing political about them. So as long as you're reasonably math oriented, you can do this. Anyway, we're done with COVID. Come April 1st to April 30th, I think it'll be April 1st, as long as you get your vaccine. Get your vaccine, get your vaccine, get your vaccine. It doesn't matter if it's the Pfizer, the Moderna, or the Johnson & Johnson. Their effective immunity, when you look at immunity, for the Johnson & Johnson, it's 70 to 75%. For the Pfizer and the Moderna, it's 95. But if you look at its effectiveness, in the remaining people, 30% in the Johnson & Johnson, the 5% in the Moderna or the Pfizer, those people have 95% asymptomatic infections, probably about 5% mild infections, and barely measurable, kind of in the 1 in 10,000 range of moderate infection to 1 in 100,000 range. So effectively, we're at 99.9% coverage, which for disease events, so that's of any significance, so we're done. And that's the fact. But the problem is we still need to get the vaccine. If we don't get enough people vaccinated, it's going to be lingering and annoying. So again, vaccinate, vaccinate, vaccinate. If you've already had it, unfortunately, I don't think you really need it, but for the most part, I would just get the vaccination because you're going to want to be able to go to a sporting event or a concert or get on a plane, and I think there'll be a vaccine passport eventually. Since the Johnson & Johnson is coming, I would encourage anyone who's had the infection already to just do that one, so that way you don't have to do two and increase your likelihood of reactions. One vaccine is going to be more than adequate for you because people who've already been infected, having a vaccine is kind of like having a second vaccine because your first vaccine was the infection. Other news to report, simply the revisionist historians are beginning. Yahoo had an article today that was a lead article about what happened a year ago on March 11th with Trump and Fauci and everything, and it's absolute recreationist history. Everything in it by the gnomes from the government, people in the health sections is made up, acted like they didn't know that the virus was coming, that it was bad, anything, and they were caught unawares, and they would have done more if they would have knew. I knew, and I'm not a paid public servant. I knew. There were several of us who clearly got it, and it's not our full-time job, and it was ignored. Just like the Taiwanese public health service knew, and other ones, but we ignored it, and we ignored it forcefully for really from January to March 1st to 7th, and it was only then that our public health leadership decided to actually do something, and what they did was not active. And so a recreationist history, which is I believe will happen now, is it will all be blamed on Trump and now the Chinese, and all of them were the saviors of the human race, which is just completely opposite of everything that happened. Not that I'm saying Trump didn't screw this all up too, but it's, again, that's not the main point. The point is recreating the public health people as our saviors when they knowingly and consistently erred on the whole thing from the beginning through even now. But they finally did something positive today with the CDC, or yesterday, with the CDC saying, hey, if you've been vaccinated, finally, you don't have to wear a mask around other people in a small group if they've been vaccinated, or if you go to another household and one person hasn't been. So they're at least acknowledging that there's actual immunity, but they're not willing to say you can go out without a mask outside or do anything like that, even though what's the total number of significant infections from outside contact? They're like very hard to measure. It's so low. The safest place is always going to be the outside. The biggest mistake we made was shutting down the outside. Outside stuff was fine. Tragic. But anyway, so just watch for that. And as they try to confirm the hero worship status of some of these public health figures, just remember it's not true. But anyway, anything else, Kim, that I'm forgetting? I think just, relax, get your vaccine, take your vitamins. I mean, there's other viruses still out there. And, if we've learned anything, that viruses get you sick, as we all knew. But if you're taking a multi, a fish oil, a vitamin D, a little bit of zinc, you're going to be in pretty fine feather to fight off most illnesses. Don't forget the neti pot if you get chronic sinus infections or anything, because again, neti pots work. Vitamin C's and the multi. I mean, I've gone over all this so many times, but I think all the vitamin stuff still lowers your risk for heart events, cancer, all kinds of stuff. So I think that's it. And if my eyes are a little cattywampus in this one, it's because I think that
I can't figure out how to make
it's the camera's over there and I'm sort of juxtaposed, so sorry. So you all take care, be good, we're through this.